So I think that's a good point in time to do a little bit of discussion, or if you have, probably the easiest would be to type a question in there, or get the mic, however you want to do it. If there's any questions or comments on those cases. Top three cases that I use the Dreal for. The number one is for the stenosis surgery in the older patients, usually the 75-year-old guy with L2 to S1, severe central lateral recess foraminal stenosis all the way down, and doesn't need a fusion, real spondylitic spine. That's the case that comes in, and it's just sort of like a sigh when you see the X-ray. You know what the MRI is going to look like. You see the MRI, and you're like, "Yep." And then you hope he hasn't had an injection, and of course he's had hundreds, and so you got to do the surgery. And so it's like one of those cases that is just kind of in the way, but great case for the patient, but definitely can be time consuming. So for those, I use the Misonics. So for those, I expose the left side. I do a osteotome on the spinous processes, Cobb the other side, retractors in, Misonics up, over, and down, take the lamina off, and then Caresins for the ligamentum, and then the Dreal for the edges for the far lateral recess, and then out each neuroframe, and then go to the other side and do it. So that's probably my number one. My number two would be just the isolated foraminal stenosis patient, and just targeting the foramen. I think this is really a great device to get out all the way out the foramen. It's real. I don't have a great tool that gets me there aside from curettes. I think it can be a real time consuming operation. And with this, I think it really speeds things up, and it gives me better decompression. The other one I've tried it on, which I've used a few times, which I really liked, was on actually SI fusion. And I use the SI bone, so the lateral implants. But I'm not. I think they do work. I do like the open decompression, or the open decortication and packing with bone graft. And with this, you can make a real small incision right over the SI joint, go down and use the unshielded burr, and basically decorticate the SI joint all the way, pack it with bone graft, and then do the implants. And I do think that helps with the fusion rate with that particular implant. That's just my personal opinion. The other one would be for that contralateral for MIS TLIF. I've tried it also for TLIF disc and end plate prep, for the end plate prep. And I thought that the benefit of that was really, you could reach all the way to the other side. I mean, you can really clear the end plate, and we took some x-rays to show how far you can get. You can get all the way through the entire disc. And they discectomy for TLIFs. Just that end plate prep, it does, there's something to that. I think that it does help. And I think we have a slide coming up on that one. Yeah, the other one, if you were using something like, let's say you're doing something like limited decompression, trying to really minimize your laminotomy, I think this is a great device to get out the frame. And I think that would, inadequate decompression obviously is a big reason for failure in decompression alone surgeries. Late foraminal stenosis or recurrent foraminal or foraminal stenosis that develops down the line just as part of natural disease progression are all sort of working against us in these cases. And so getting a wide decompression of the foramen in the far lateral recess, during the time of surgery, I think it helps prevent surgery down the line. In terms of time savings, yeah, I think there is a definite time savings in this with this device. The other thing that is nice is if you've made your Caresin, let's say you're just using a Caresin, you're working Caresin. Anytime you see those little sharp, bone edges that you're holding and waiting, and you're protecting, and then you're hoping that those aren't there when you've finished. This is a nice device. You can trim along the edge there and just really smooth all that out. Make sure that you don't have any of those little edges that could come back and get you, later with a late CSF issue or pseudomalacia.